Come in.
Hello. May I come in?
Yes.
Hi, I'm Amanda. I'm your nurse today.
Hi, Amanda.
How are you doing?
I'm all right. How are you?
Good, good. Can I see your armband, please?
Sure.
Can you tell me your first and last name?
Louise Lima,
Okay, and your date of birth?
February 3rd, 1991.
Okay. Can you tell me why you're here?
I need a physical for school.
Okay, well, do you mind if I do a head-to-toe assessment on you?
Yes.
Oh,
That'd be wonderful.
all right. Well, I'm going to start with doing your vital signs. Are you in any pain?
No.
No, not at all. No. No, on a number scale from 0 to 10, 10 being the worst kind of pain, can you tell me a number?
Just 0.
A 0. Okay, I want to put this on your arm to do your blood pressure. Okay. I'll put this on your finger. Okay, and I'm going to check your temperature. And while this is going, I'm checking the rise and fall of her chest and her respirations, if they're even and non-labored, and if she's having any signs and symptoms of shortness of breath. Do you having any difficulty in breathing?
No.
No? Okay. Her pulse ox is showing that her saturations are at 97% and her heart rate is at 90 and her blood pressure is at 120/80. Okay, well, I'm going to start at the head and work my way down. I'm going to feel for any bumps and lumps and even hair distribution. Do you have any headaches right now or any pain in your head?
Nope.
Okay. I'm going to take my pen light and I'm going to see in your ears. Okay. All right. I'm going to look into your eyes right now. Very good. Very good. Now, can you follow my pen light? Very good. I'll put this way. Very good. Okay, I'm going to take a look into your nose. Can you look up to the ceiling for me? Okay. And can you open up your mouth for me? Can you say ah?
Ah.
Okay. And can you smile for me? Okay. Everything looks good and moist. She doesn't have any skin lesions or mouth lesions in her mouth. Do you have any teeth pain?
No.
No? Okay. Well, I'm going to feel in your neck and see if you have any bumps or any swelling. I'm going to feel for your carotid pulse. Does that hurt when I do this?
Nope.
Okay, well, I'm going to listen to her lungs and I'm going to start right underneath the clavicle. Go ahead and take a deep breath. I'm going to listen to both sides bilaterally. She sounds clear on both sides. I'll go ahead and ask you to lean forward. I'm going to keep going back and forth to both sides. Keep taking deep breaths. Patient does not have any diminished breath sounds. Everything sounds clear. You can go ahead and sit back. I'm going to go ahead and look at her abdomen and make sure it doesn't seem distended. Do you have any abdomen pain?
No.
No? Okay, well, I'm going to go ahead and listen to her bowel sounds in all 4 quadrants. I'm going to listen in all 4 for a full minute. She has positive bowel sounds ×4. Then I'm going to feel Does that hurt?
Nope.
Okay, now I'm going to percuss. Does that hurt when I do that?
Nope.
Okay, stomach is non-tender. Okay, now I'm going to go to her extremities. I'm going to feel for her brachial pulses. I'm going to make sure they're strong and equal. And they are with 2+. I'm going to go to her radial and make sure they're equal. And they are with 2+. I'm going to check her skin and make sure it's warm and dry, which it is. I'm going to check her turgor and make sure it's not tenting, which it is, and make sure she's hydrated. I'm going to look at her finger beds and make sure she has no clubbing, and check her her bed and make sure that it's less than 3 seconds, and it is. Okay, and then I'm going to check her femoral pulse, and I'm going to check her lower extremities and make sure they're even with size, and it is. I'm going to go underneath her legs, underneath her knees, and check her popliteal pulses and make sure they're equal and strong, and they are with a 1+. Then I'm going to go down to her feet, check above her feet, and make sure these pulses are equal with a 2+. Then I'm going to go to the side of her ankles and make sure these pulses are equal. I'm going to check the cap refill of these toes. Make sure they're less than 3 seconds, and they are positive with less than 3 seconds. And if you could push on my hands for me, thank you. And if you can do that, pull on them for me, thank you. And I'm going to check underneath her heels to make sure that she's got blood, or I could, what's that word? Oh, I can, hold on one moment. That there's non-blanchable, which it's non-blanching, or it's blanchable. It's blanching for me, which is good. There's no breakdown under those bony promise. Let me just take a second here and think about what else there is to do. Can you go ahead and squeeze my fingers for me to make sure that you have equal squeezing? Very good. You can just give me 1 second to see what else I need to do for you. Everything seems to be looking pretty good for you, for your stuff to do. All right, well, thank you. You seem to be pretty good to go. All right, thank you.